Hey everybody, long time no see. I know I haven't made a video since June, so that's been like 5 months. And that was my NCLEX video I made, I think, of me passing NCLEX. But anyway, I'm just coming in to just inform you guys about some stuff that's been going on with me. I've been working now for, on the 27th of this month, it will be 3 months at a state hospital on a busy med-surg / telemetry floor. And I'm liking the experience I'm getting because being that we are a state hospital, we get any and everybody, people with and without insurance come to us. It's a teaching facility, so there are a lot of new doctors there, a lot of new nurses there. So it's like everybody, for the most part, pitch in and give their input so we can take care of the patients. And it's a big learning experience for me and just for everybody. Taking care of the patients some days is a little bit difficult than on other days because the acuity level of some of the people is kind of high on my unit. So some days you might have everybody who's kind of tore up, so to speak, and total care. Then on other days you might have everybody else who are up at lib and they just might have a minor thing going on with them. So it doesn't take too much to take care of them. So the difficulty level of the job ranges from hard to really hard. And when I started working there, within like the first week, I was already ready to quit because I was so discouraged and disgusted about just everything, because I felt that I had to know everything right then and there, and I had to just I talked to a few friends of mine friends of mine who are nurses also, and a few nurses in my family, because I come from a long line of nurses and people in the medical field. I talked to them and kind of just explained to them how I was feeling, and people gave me pep talks to motivate me, to keep me going, and told me, like, don't expect to go into this situation as a new nurse on a busy unit and think that you can manage all this stuff and not get overwhelmed, because you are going to get overwhelmed. But just take a mental pause and a break, take a deep breath, collect yourself, and do the best job that you can, and do what these two hands can do. And that's all. These two hands. Like, don't try to do too much, and be willing and able to ask for help whenever you need it. And don't feel afraid to ask questions, is what a lot of the other nurses that I work with told me. They said, like, we are here even after you get off of preception and orientation. If you have any questions, we'll be here to answer them for you. And I work with a good crew of people. On my night shift, I work 7 P to 7 A, and on the night shift there are a lot of new nurses on the shift, but there are some experienced veterans on the shift too there to turn to us if we're having problems inserting the IV, or if we are experiencing something with one of our patients that we just really are totally clueless about. You can turn to the other nurses for help. So I've been learning a lot these last 3 months. I've been really busy. The money is good, but you work really hard for that money. I got me a new car because I was driving that old 1995 white Altima. I had Nissan Altima, and it just started to get kind of just unreliable. So I got me a new Dodge Challenger 2012. I'll show a picture of it. I'll try to. And I really liked it. Driving in it, I feel like I waited a long time to have that car. Like, I struggled enough with my broke down Altima, and I deserve to have something nice. So I really like my car. I hate that I just got my first ticket in that car, though, and the police officer pulled me over. It's just a long, stupid story. Basically, I had to pay a $149 ticket, and the only reason why I really was pulled over was because I was in that brand new car with the new tags on it, and since it's kind of like a sports car, they just pulled me over. I know that when the officer pulled me over, the first thing she said was, "Oh, I know you in your new car and you want to drive and everything, but please whatever else she was saying. So it let me know as soon as she pulled me over why she pulled me over. It was because I was in my brand new car. So I was kind of pissed off about that, but I paid the ticket. I'm just going to forget about. Oh, and I knew the police officer too. I knew her. She was like a family friend. She knew me. She still wrote me a ticket. So that helped zero. It helped zero. Nothing for knowing her. It still got me a ticket. But I'm going to pay the ticket, and that's it. And if I see the police officer again, we aren't cool anymore, because even if those people have to do their job, it's still like when you know people, I know all y'all have heard this saying, it's not who you know, it's what you know. And when you know different people, you get a slap on the wrist sometime, or knowing different people will get you different job positions. You know, that's the whole point of building up relationships with people. And I feel like it was kind of bad. You know, this is to me getting pulled over, and a family friend, somebody who I know, gives me a ticket. You know, I know she's only doing her job. She's a new police officer, so they have their quota of people they have to write those frivolous tickets on, so I understand it. But yeah, that was really bad to me. Anyway, I just paid the ticket, and I'm going to forget about it, because the $149 really, now that I'm working, doesn't take me that long to make now. That's another bright spot in being a nurse. Like I said, the pay is good, but you feel like you should be paying more, because truthfully, I feel like we do more work than the doctors. And on the shift that I work, there's one aide for a 24-bed unit. It's one aide. She can only do so much. And we're always short-staffed with nurses for the most part, and we just try to make everything work. And when people have to go down for procedures and anything throughout the night, any kind of exam or test, we have to transport them. So we are the aide, the nurse, and the transport person. And some nights we're the doctors too, when the doctors don't know what's going on with the patient. And we've been with them all day, so we have to help the doctor try to, come to a understanding of what might be going on with their patient. So it's just a lot of stuff going on. I'm enjoying the experience that I'm getting from working the floor, but I know that I don't want to do that for the long term though, because it's too strenuous some nights, and you leave totally beat down. And I know that's just a normal part of nursing, and since I've been working, things have gotten better. They have. You learn how to manage your time better. So things have gotten a little better. I've noticed that, and as time goes on, I know that I'm going to get more, better and efficient with managing my time. But yeah, I don't see myself working that floor for the long term though. Just maybe they usually tell you get a year. So maybe a few more months of that floor, and before I just decide to, uproot myself and maybe go on to somewhere else, because the beauty of nursing is that you don't have to stay in one area. There's a wide area, a large spectrum of what nurses can do. You have psychiatric nursing, clinic nursing, dialysis centers. You can work as a nurse there, being a dialysis nurse. You can do home health. You can do hospice. You can do just a lot of stuff. Community nursing, working in the health. Well, I already said clinic. But yeah, I'm just giving y'all a example of how nursing is very, what's the word I'm looking for? Versatile? I don't know. Anyway. Also, I wanted to say this. It's funny, when I first started working and I walk into a patient's room, different patients, they look at me crazy, or their family might be, oh, are you physical therapy, or are you the aide? I think I've gotten, am I housekeeping before? And I'm like, no, I'm the nurse, I'm the RN. And some people just be sitting there in amazement and baffled. And because I guess, they can't believe that I'm a young, black, male RN. And I've gotten a few comments that I didn't like that much, but it just comes with the job. And I've had things like, I gotta call my husband and tell my husband I have a black nurse taking care of me. And I'm thinking to myself, oh my gosh, did you just tell me, did you just say that to me? But some people don't mean anything by it. They just, some people come from different areas, and it's not, I guess, common to see a male, or especially a young black male nurse, taking care of you. But yeah, I purposely go out when I get off of work, and I go out and I wear my badge when I go run any errands or go to the store after I go to work or before I go to work, so that people can look at the badge and see RN right there, and so that they can see that young black males are doing something with themselves. Everybody isn't out committing crimes like some people think. It's some of us who are doing stuff or making moves and being successful. So I wear my badge when I'm out, and I get a lot of people looking at my badge, trying to sneak and look at it real quick. Or they'll say, oh, you're RN, I'm going for that too, or my sister's there, or this and that and this and that. But yeah, I just proudly wear my badge, because all of y'all who've been following my journey on here, you know how long it took me to get there. So, yeah. What else? Oh, and happy Thanksgiving too. Like, yeah, today is Thanksgiving. I don't know why I forgot that. I think that's pretty much it. Told y'all what I've been doing. Told y'all about my new car. And that's it. It's pretty much it. I took some more pictures that I'm going to post too. Some more professional type quality pictures I took with this guy, Jay Brown here. I've took pictures with him before in March or April. I took some graduation pictures, but I really didn't like them because I was like 20 pounds heavier around graduation time. And now I'm not at my goal weight, but I'm in a more comfortable space with my weight. So I'll probably post the newer pictures, and maybe I'll post the older ones from March too, so y'all can see like a side by side, or comparison of what I'm talking about. But the pictures came out really nice, and I just took them just because I like taking pictures, and just keeping a record of kind of like what I was doing at the time. I can look at the picture and say, oh, I took this in in fall of 2012. I was just finishing nursing school, blah 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 blah. But yeah, things are going good. I hope that everybody else who is subscribed to me or stumbled across this video, hope y'all lives are going good, and that y'all just stay focused and motivated on your road in nursing, because it can get really hard and really difficult, and you might want to quit, but don't, because it's worth it. On some days, like I said, the work is a killer and really hard, and you get kind of upset, but on other days you get that good satisfaction and gratification of knowing that you took care of someone who really needed your help, and you played a part on the road to them getting better. And you have your patients tell you that you are real nice, or you brighten up their day, or the family say that you took good care of my relative. That's a good feeling to have, and when people tell you that. So sometimes that's almost better than getting a check, sometimes. But yeah, I guess I'm going to go and leave comments. Let me know how everyone is doing. Some of my people who aren't following me on different... I should post my Instagram. I might post a link to my Instagram so y'all can follow me on there, because I also have a Twitter, but I never really use my Twitter. But anyway, let me leave before I keep rambling on. I will talk to you all later. Take care.